بسم الله الرحمن الرحيم. هيام عبد المنعم صدقة, Professor of Parasitology, Module 18, the lecture number 7. Free living amoebae are Naegleria and Acanthamoeba. Both amoebae are facultative, as they live with host and without host, but Acanthamoeba only is an opportunistic parasite, as it causes pathology only in immune suppressed patient. In comparison between the two amoebae, as regards the habitat, both amoebae inhabit the soil and the stagnant fresh water of ponds, lakes, and swimming ponds. Acanthamoeba inhabit also the dust. In the host, the final habitat of Naegleria is the central nervous system of man, while in Acanthamoeba, beside the central nervous system, the Acanthamoeba can inhabit eyes, skin, lungs, and the urethra. Morphologically, Naegleria has two forms of trophozoites, amoeboid and flagellated form. The amoeboid form consists of a mass of cytoplasm, includes many food vacuoles and a contractile vacuole to regulate the osmotic pressure, and the movement is by the aid the locular pseudopodea, while the locomotion of the flagellated form is by flagellae. The trophozoid has one vesicular nucleus with a large chromatin dot. Its cystic stage surrounded by a thickened cell membrane and the same structure inside. While Acanthamoeba has one form of trophozoid which moves by the pseudopodea, and it is characterized by the spike-shaped structure protruding from the cytoplasm. The cyst is very resistant because it has two walls, an exocyst which is shrunken in shape and the endocyst which is polyhedral in shape. As regards the life cycle, the red arrows presenting the external environment, since in both amoebae any stage can change to other and the vice versa, while the blue arrows represent the entrance of the infective stage, trophic stage of Naegleria, enter through the external nasal opening, while Acanthamoeba, mode of infection of Acanthamoeba through any opening in the body, either from the eyes, nose, urethra, or even the skin wound. When the infective stage enters through the nasal opening, Naegleria will migrate and penetrate the nasal mucosa, ascending through the olfactory nerve, reaching to the brain. So the diagnostic stage of Naegleria is amoeboid trophozoid only in the brain, while Acanthamoeba infective stage of Acanthamoeba is through trophic and the cystic form. Change it to trophozoites, enter through any opening of the body, then to the bloodstream by hematogenous spread, reaching the brain, and the diagnostic stage of Acanthamoeba in the brain, post-trophozoid and the cyst. So the only amoebic cyst present in host tissue is the Acanthamoeba cyst. The Naegleria fowleri will cause an acute disease which is called the primary amoebic meningitis, while the disease of Acanthamoeba amoeba is subacute or chronic. It is called the granulomatous amoebic meningitis to occur in immune suppressed patient, while keratitis, amoebic keratitis caused by Acanthamoeba amoeba, occur in healthy people. So, the symptoms of primary amoebic meningitis simulating the symptoms of meningitis, starting early with prodroma in the form of respiratory distress, fever, headache, nausea, and vomiting. Late manifestation of meningitis in the form of neck rigidity, coma, and death in about 6 days. While the central nervous system manifestation caused by Acanthamoeba infection, simulating the symptoms of the space-occupying lesion. But in AIDS, it will give acute encephalitis manifestation. In the eye, keratitis and corneal ulceration, while in the skin, ulcers will be formed. To diagnose a case of reliving amoebae infection, in case of Naegleria fowleri, history of swimming must be present, but here may or may not be present in Acanthamoeba. As we call clinical picture of Naegleria fowleri infection simulating the manifestation of meningitis, while Acanthamoeba manifestation simulating the symptoms of perine abscess. We shift to laboratory diagnosis. Laboratory diagnosis of Naegleria infection is starting with microscopic examination of CSF. Characters of CSF appears cloudy but sterile. Cloudy but sterile. No bacteria present in it, but the cloudy appearance is due to the presence of large amount of pus cells. It is bloody under tension, and the protein content reaching more than 1 gram per liter CSF. We can demonstrate in positive cases an amoeboid trophozoite. This is the diagnostic stage. If the microscopic examination is negative, we shift to culturing the CSF on non-nutrient agar medium streaked with Escherichia coli bacteria. In culture, we can demonstrate amoeboid trophozoite in a new culture, but cystic form will be demonstrated in old culture. There are many other methods to diagnose Naegleria fowleri infection, such as mass spectrometry, proteomics, by the biomarkers. MRI of the brain will show abnormal midbrain and subarachnoid space. Laboratory diagnosis of Acanthamoeba mainly by scraping from the lesion, and if the brain is affected, brain biopsy will be done. If these are negative, we shifting to culturing the sample on non-nutrient agar streaked with Escherichia coli. The diagnostic stage here, either in the samples from the lesion or from the brain sections or in culture, will show trophozoites and the cysts in all samples. We can observe that the Acanthamoeba aren't present in CSF because it reaching the final habitat in the central nervous system through hematogenous spread. These pictures show cyst of Naegleria fowleri in old non-nutrient agar culture. And this is the trophozoite, many vacuoles, and one vesicular nucleus with large chromatin dot. Acansamoeba calpersoni, this is a cyst of Acansamoeba calpersoni with the characteristic double wall. The endocyst is polyhedral and the outer is shrunken in shape. This is the trophic form of Acansamoeba with spiky structures projecting from the cytoplasm, including many vacuoles and large chromatin inside a single nucleus. This is the eye affection in the form of affection of the cornea. This is the brain tissue showing trophozoites of Acansamoeba, and this is cyst of Acansamoeba in brain tissue. To treat a case of reliving amoebae infection, the drug of choice is amphotericin B4 post or fungizone. Fungizone is administered either intravenous, intraventricular, or intrathecally till the CSF becomes free, becomes clear. Also in Acansamoeba, we can give chloramphenicol, and for eye affection, eye drops, Prolene or propamidine, and the corneal ulcer may need keratoplasty. To prevent this infection, health education to the swimmers that don't immerse the head during swimming and avoid swimming in places fed by hot springs. Also, fresh examination must be done to the fresh water lakes and the swimming pools with adequate chlorination, superchlorination of the swimming pools and public water supply. For contact lens wearers, they must use a sterile solution for cleaning their lenses and never use the tap water. Also, shouldn't use their lenses during swimming. Thank you.